Osteoporosis. Osteoporosis is a condition of skeletal fragility due to progressive loss of bone mass. It occurs in elderly people of both sexes, but is most pronounced in postmenopausal women. Osteoporosis is characterized by frequent bone fractures, which are a major cause of disability among the elderly population. Non-drug strategy to reduce bone loss in postmenopausal women include a diet adequate in calcium and vitamin D, weight-bearing exercise, and cessation of smoking. In addition, patients at risk for osteoporosis should avoid drugs that increase bone loss, such as glucocorticoids. Bisphosphonates are preferred agent for prevention of postmenopausal osteoporosis, and they have the suffix of dronate, as you can see there. Etidronate, residronate, alendronate, ibandronate, palmidronate, telludronate, and zoledronic acid comprise an important drug group used to treat the disorder of bone remodeling, such as osteoporosis and Paget's disease, as well as for treatment of bone metastasis and hypercalcemia of a malignancy. The bisphosphonates decrease osteoclastic bone resorption via several mechanisms, including 1. Decrease in osteoclastic formation or activation, increase in osteoclastic apoptosis or programmed cell death, and inhibition of cholesterol biosynthetic pathway important for osteoclastic function. Here's a table just summarized in terms of the potency of the class of drug that we call bisphosphonate. As you can see, etidronate, which is the lowest in terms of potency, and zoledronic acid and ibandronate are the highest in terms of their potency in terms of anti-resorptive activity. Residronate is also available in once monthly oral dosage form, as is ibandronate. So Actonel and Boniva are available in oral dosage once per month. Bisphosphonates should be administered with at least 6 to 8 ounces of plain water at least 30 minutes before eating breakfast or taking other medications. For patients unable to tolerate oral bisphosphonate, intravenous ibandronate, zoledronic acid are alternative treatment for osteoporosis. Intravenous ibandronate is administered once every 3 months, and zoledronic acid is administered once per year. Alendronate, residronate, and ibandronate are associated with esophagitis and esophageal ulcer. To minimize the risk of esophageal irritations, patients should remain upright for at least 30 minutes after taking bisphosphonate. Selective estrogen receptor modulator, SORM. Estrogen progesterone therapy is no longer the therapy of choice for treatment of osteoporosis in menopausal women because of the increased risk of breast cancer, stroke, venous thromboembolism, and coronary disease. Raloxifene is a selective estrogen receptor modulator approved for the prevention and treatment of osteoporosis. It increases bone density without increasing the risk of endometrial cancer. In addition, raloxifene reduces the risk of invasive breast cancer in women at high risk. Raloxifene is the first-line alternative for postmenopausal osteoporosis in women who are intolerant to bisphosphonates. Raloxifene reduces serum total and low-density lipoprotein cholesterol concentration. Salmon calcitonin administered intranasally is effective and well tolerated in the treatment of postmenopausal osteoporosis. This drug reduces bone resorption, but it is less effective than the bisphosphonates. Teriparatide is a recombinant segment of human parathyroid hormone that is administered subcutaneously for the treatment of osteoporosis. Parathyroid hormone given continuously lead to dissolution of bone. However, when it is given subcutaneously once daily, bone formation is the predominant effect by preferentially stimulating osteoblastic activity over osteoclastic activity. Teriparatide, or known as Fordiol, should be reserved for patients at high risk of fractures and those who cannot tolerate other osteoporosis therapy.